Thank you very much, Mr. Chairman. I just have to jump in on the mushroom bandwagon here. Of all different types of mushrooms, I agree, but the data on psychedelics is extraordinary in terms of helping our veterans with PTSD, the ongoing research done at Hopkins and Columbia. I think it's something that we as a nation need to start looking at, especially if we're trying to help a lot of folks who are coming home hurt and harmed, and I think it's a great specialty crop, perhaps, an opportunity. But I will jump off of that before my staff gets mad at me that I'm off script. Look, the title of the hearing is How the Farm Bill Works for Specialty Crop Producers. Unfortunately, it doesn't work well. It really doesn't. We are a nation, as you so rightly said, that our federal dietary requirements say 50% of our diet should be specialty crops, but less than 10% of the farm ag subsidies go to farmers who grow fruits and vegetables. It's a stunning reality. And if you're a small farmer growing specialty crops, the Farm Bill does even less to really help you. It's a stunning reality. In fact, 93% of small farmers don't get crop insurance. Only 7% take advantage of it. This is really stunning, especially when the majority of our farmers in America are small farmers. And what they do for local food systems, what they do for rural communities, the added benefits that our small family farmers in America are doing are incredible, but we are a government that has really established help and support for large commodity crops and making it very hard for the food that we eat as a country to be produced. And so really quickly, Ms. Kobus, as you know, many organic farmers operate these small acreage farms. Yesterday, I introduced a bill to establish an Office of Small Farms at USDA, which would directly serve small farmers with micro grants and technical assistance and would do a review of all USDA programs to make sure that they're accessible and beneficial to these small farmers. Can you explain really quickly the impact this type of USDA office would have for the farmers that you work with?
Absolutely. It would have huge impact. I support that idea 100%. It would give them a voice and get them a short way to reach help and reach assistance with the programs that are out there. A lot of the programs aren't being taken advantage of because when you run a small farm, farmers want to farm. They don't want to do paperwork, not to mention redundant paperwork. And so it would be huge in giving them the support they need to walk through what actually can help their farm and get it moving.
Yeah, the bureaucracy that a small farmer has to go through who is not equipped to do it is stunning. And one of the things when I visited with farmers, organic farmers around New Jersey, I just did not know the whole crop insurance system is not built for small farmers. They get, the people who do this get commissions that are based on the size of the insurance policy premium. It's a kind of a warped, in my opinion, incentive. These incentives focus agents on writing policies for the big farms and disincentivize them from helping the majority of the farmers in America who are small farmers. And so I believe this Farm Bill, we need to change this structure so crop insurance commissions are based on the complexity of the policy, not the policy size, which would incentivize the agents to write a lot more crop insurance policies for small specialty crops. And so would this type of change be beneficial to the organic farmers that you work with?
Yes, absolutely. Additionally, technical assistance to educate those insurance agents would be additionally helpful. And data collection about the value of these specialty crops. If we could get the land grant institutions doing and compiling research on the value, it would definitely help with the crop insurance issue.
I really appreciate it. And then just lastly, Mr. Carter, you state in your testimony that USDA should use its purchasing power within the fresh fruits and vegetable programs to buy locally grown fruits and vegetables. We have incredible power within the federal government, but we're not using it to help to sustain, again, the food that American eats, not the ones that we put into the larger global commodities market or put into feed. This is folks who are growing the foods that are keeping America healthy at a time that, again, Mr. Wingard, you pointed out, we are a nation that is exploding in diet-related diseases caused by this hyper-processed foods. And it's stunning to me the cost taxpayers are paying right now. About $1 out of every $3 that our federal government spends is being spent on health care. The overwhelming majority of that is for preventable diet-related diseases. And so can you just talk about the impact it would have on local food systems, on local communities, on rural communities, on farms like yours, if the USDA substantially scaled up local procurement?
Yeah, thank you. It would be, like I said, the schools are embedded in the communities where the food is grown. And like I had mentioned, it's highly seasonal. We could scale up our production if we knew that there was an access to sell surplus, right? So I would put substantially more tomatoes and cucumbers and the like. If I knew that as I had surplus, as I had more supply than my own small retail stand could move, that there was an institutional buyer ready and incentivized to take that crop.
And Mr. Wingard, lastly, and I know I said two lastlys, but the programs like SNAP you mentioned, I've seen the incredible success of the GusNIP program, for example, drawing people towards local farming systems. It's an incredible purchasing power that we're using. Unfortunately, what I see often SNAP dollars used for without those incentives is the very foods that often lead us to explosions of diabetes, explosions of diet-related diseases. So is that a way, by trying to do incentives within already existing programs like GusNIP, to get more of that governmental purchasing power towards supporting those who produce healthy foods?
Yes, sir. And you got to realize people that are on SNAP are the people who need it. And they don't have a lot of purchasing power when they go into the grocery store. Our crops, a lot of times, are the more expensive crop or the more expensive products in the store. So they're going to feed more mouths with less money by buying those items than buying our items. So any kind of way we can get those SNAP recipients incentivized to buy fresh fruits and vegetables will be good, because it will start that transition in their lives to a healthier diet, to a healthier lifestyle, and less medical costs down the road. The fresh fruit and vegetable snack program is a great example of this.
Mr. Wingard, you are a kind, gentle man. I'm going to be your anger translator here for a second. It's not only the free market that's making organic foods more expensive. When my kids walk into a bodega, they're paying less for a Twinkie product than an apple because we subsidize everything in the Twinkie and not the fresh fruits or vegetables. So it's not like you're working in a free market. You're working in a market that's stacked against the commodities and crops you're growing. I will be your anger translator anytime you want, sir.
Based on what you just said, and I've heard the argument a while back, we have subsidized obesity.
Yes, we have. And not just obesity, we pay twice. We subsidize the things that make us obese, and then we subsidize the Medicaid and Medicare that treats everybody. We're a government that is digging a deeper and deeper hole that's not only racking up costs. If you look at Medicaid and Medicare costs over the 20 years projected, we won't be able to afford anything in government. So we're not only digging a deeper and deeper hole, but we're also adding to sickness and misery in our society. It's ridiculous. All right. Mr. Chairman, thank you.